Peripheral nerve injuries, often resulting from trauma or surgery, can sometimes lead to a more complex condition known as centralized pain. Unlike typical neuropathic pain, centralized pain involves changes in the central nervous system, making it harder to diagnose and treat. Patients experiencing this condition often report persistent pain that significantly impacts their quality of life and daily functioning. However, until recently, the criteria for diagnosing centralized pain following a peripheral nerve injury have been unclear, making it challenging for clinicians to identify and manage affected individuals. This video explores the latest evidence-based diagnostic criteria, aiming to clarify how centralized pain is recognized and what signs clinicians should look for. To address the uncertainty in diagnosing centralized pain after peripheral nerve injury, researchers conducted a systematic review of the medical literature. They searched major databases including MEDLINE, EMBUS, Web of Science, and Central, focusing on studies that examine diagnostic methods for centralized pain following nerve injury. Review included studies that described clinical features, diagnostic tests, or specific signs of centralized pain, while excluding those focused on acute pain, pediatric patients, or non-English articles. Out of 950 citations, 28 studies involving over 6,000 patients were analyzed. This comprehensive approach allowed the researchers to synthesize the most reliable evidence and propose clear diagnostic criteria for clinicians. Based on the evidence gathered, the review proposes 5 key diagnostic criteria for centralized pain after peripheral nerve injury. First, there must be a documented injury or compression of the peripheral nervous system. Second, the patient should experience neuropathic pain that persists for at least 3 months. Third, symptoms such as hyperalgesia, allodynia, or other hypersensitivities should extend beyond the original injury site. Fourth, mood or cognitive disturbances are often present, reflecting the broader impact of centralized pain. Finally, if a peripheral nerve block is performed, the pain relief should be limited, less than 50% reduction. These criteria provide a structured, evidence-based framework for clinicians to identify and manage centralized pain more effectively. Introduction of these evidence-based diagnostic criteria marks a significant advancement in the management of patients with centralized pain after peripheral nerve injury. By providing a clear framework, clinicians can more confidently identify patients who may benefit from specialized interventions. This not only improves patient outcomes but also streamlines the diagnostic process, reducing uncertainty and unnecessary treatment. As research continues, these criteria may evolve, but for now, they offer a practical guide for healthcare professionals striving to improve the quality of life for those affected by this challenging condition.